Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. This is a webinar where we get to talk about Lyme disease. I look forward to the questions you have because your questions create our webinar. So we'll see what kind of themes you get into tonight, or if there are any themes of the evening. Sometimes there are, and sometimes there aren't. I try to answer your questions to the best of my abilities. Sometimes you all stump me, and sometimes you raise some issues that help educate me so I can go back and learn some new things too. So I look at this as a two-way process where we're both getting, we both get some, I guess, new learning and education out of it at times as well, too. I do hope that you find this helpful tonight. I hope you learned some things that can help move your Lyme treatment forward, or at least give you some answers to some of your questions. If you do find benefit from this, the one thing I keep asking people to do is share. Share with others you know that may benefit as well, and share the links with them when I announce that a webinar is going to take place, or when I share with you the email tomorrow morning of the recording. So yes, I am doing a recording again tonight, as I do. And if everything goes as planned, if the recording does work, and if I get it edited in time, I have to do some brief edits on it tonight, then that should be ready tomorrow morning around 9 to 9:30. When you get the email from me announcing that the recording is ready, just so you know, that email will also include the sign up for next week's webinar. All right. So we are doing another one next week and doing one the week after that. So this is one of 3 in a row. To those of you that are new here, I'm glad to see that there are some new names on my message board. And the way you participate in 2 ways. One, you can write questions to me. And the way to do that is at the bottom of your right-hand side of the screen, there is a chat box. Write your question to me there. The one thing you should be aware of, each time you hit the enter key, it actually sends a separate question to me. So I ask that you just write one long run-on question so that I only see part of your whole question when it's complete. The other thing is, I'll try to be brief with your questions. This format does not work out well for your life story kind of questions, okay? So brief questions tend to work better here, all right? And let's see. For those of you that are here again, I see a lot of familiar names too. I'm glad to see you keep getting value out of this. So without any further ado, let's go ahead and get started here. All right, so this first question is from Dave. Oh, I should have mentioned, in the live version, where all of you are participating here right now, you're going to get to see the questions post on your screen as I post them, okay? In the recorded versions, they don't show up, so I will read the questions so that people in the recorded version can follow along with what we're talking about here too, all right? And the reason when we're doing these, if you see me looking over that direction, that's because that's where the question posts on my screen, all right? Mine doesn't post right on the screen in the middle. All right, so let's go ahead and get started here again. So hi, Dr. Ross. Any thoughts regarding having Lyme patients wait for the Novavax vaccine, which would be available later this year? Here in California, COVID numbers are extremely low. My Lyme doctor is 100% against the vaccine and has advised all his patients not to take it. I've heard Dr. Stephen Phillips and many other Lyme doctors state that they are personally waiting to take this Nova vaccine instead of what's currently available. Thank you. So what I would say about the vaccine is the current Pfizer and the Moderna vaccines are the mRNA vaccines. I believe the Novavax is going to be a killed virus vaccine, or they're using a virus to host the genetic material of the COVID. I just really disagree with a lot of my colleagues that are against this vaccine. This vaccine, the Novavax or the Moderna and the Pfizer, have been working well in Lyme patients. And recently, maybe about a month ago, LymeDisease.org, which has a project called My Lyme Data, actually queried patients that had people with Lyme that had the COVID vaccine to find out what their responses were. And what they found is that those people are having similar responses to anyone that don't even have Lyme. And yes, when you get the vaccine, it's going to temporarily cause a flare-up in cytokines, just like Lyme gives you a flare-up in cytokines. So it may make it look like your Lyme symptoms get worse. This is a vaccine that does not basically temporarily turns on your cell's ability to make the spike protein that ability to make that spike protein eventually goes away, and we don't have perpetuating spike protein in us. I have seen the argument, there's tons of arguments a lot of my colleagues are making against this vaccine. I think largely they are unfounded, that if there were any major problems to have it discovered based upon their theories, that they would have come up in the safety studies so far. So I actually have been recommending that my patients get the vaccine. As to whether Novavax is going to have any less of a chance at triggering side effects than the other ones, I don't know. I haven't seen any of the scientific data on that yet, okay? And even though you may have lower rates of COVID, it's still out there. And people up here in Seattle are still getting it, and we're about a 50% vaccine rate here. It is not something you want to get. I would take the potential side effects of a COVID vaccine any day over the risk of getting COVID and having bad consequences from that. Okay, but I will tell you, the Lyme doctors are across the board here on what to do with this, but I tend to fall into the camp of get it, even as the community rates drop out there. All right? All right. Thanks for the question, Dave. Hello, S. Let's see. I read somewhere that zinc supplements may have interactions with quinolone and tetracycline antibiotics, so lowering their levels in the body. Have you found this to be true? Should I stop using zinc picolinate from Thorn if I end up doing a doxy plus grapefruit seed extract protocol for 2 months? So the only, regarding doxycycline, I just want to talk about that one specifically first. So the only mineral that is really contraindicated, something you would not want to take with doxy, that's calcium. Calcium is well known to decrease absorption of the doxycycline, which is why when we have people take doxycycline, I advise against being on milk or milk substitute products. Those milk substitutes like almond milk and rice milk and soy milk often have calcium added. Okay, so generally you want to avoid things that have calcium in them. But beyond that, I've not had people stop taking zinc picolinate. I am not aware of any data that says zinc interacts abnormally with doxy or with the grapefruit seed extract. So I think you'd be okay doing that. So zinc and tetracyclines, I am not aware of any problems, and I have used them before, not had problems. The quinolones, I'd have to look into that. I haven't used quinolones often or haven't used them really for a few years now, mainly because I think there's a lot of other alternatives we have, and the quinolones run quite the risk of developing tendon inflammation and potential tendon tearing of their tendons. So I tend to stay away from the quinolones unless there is nothing else I can use. So, but I haven't used them in a few years. So I'd have to look back and see if zinc is an issue there. But on the doxy and the grapefruit seed extract, I don't think you have any issues there. Okay? All right. Good luck, S. Hello, Megan. Hi, Dr. Ross. I have been treating primarily Bartonella and background Lyme for 4 years. All treatments this far have failed, and they have indeed been comprehensive with both natural and prescription approaches. With each attempt to treat, I have gained some symptom management, but stopping treatment, symptoms return. My question is, are all treatments cumulative and additive, each progressing one to the ultimate treatment end, hopefully? Or is that if one treatment fails, the next starts from ground zero, so to speak? When we see all symptoms return after discontinuing antibiotics, wondering if so many years trying to kill this thing were in vain, or if each step I've taken has worked to help break down the power of the infection as a whole. Thanks. All right. So, Megan, I understand the question you're asking. And so the thing about, a couple thoughts here. Number one, so with Bartonella especially, and some people, it just can be really a difficult germ to get under control. But if you have done some things, you probably slowly are decreasing the germ load in the body. And so hopefully you get to a point that you've got the germ load down to a point the immune system will be able to take care of it possibly, okay? And the other thing that you should be aware of with some of these antimicrobials, the reason people immediately get worse when they stop is in addition to the antimicrobials killing germs, Many of them actually are anti-inflammatory too. So the quick return of symptoms you sometimes get, people sometimes get, does not have to do with actually the germ resurging, if you will, but rather just the inflammatory state isn't being managed as well once you get off of the herbal or prescription antibiotics, okay? And then secondly, when somebody has a hard time getting better, you have to look at things that might be interfering with how the immune system works, such as heavy metal toxicity. And sometimes getting that under control, or looking for other toxicities like mold, getting those under control, sometimes that will help as well too. But overall, it is my opinion, and there's no science that backs this up, that when people have been under long-term treatment, now probably what we're doing with a lot of these antibiotics is cumulatively knocking down the germ load, and hopefully we hit a threshold at which your immune system can take over and get rid of it, or the remaining herbal antibiotics, prescription antibiotics, get the job the rest of the way done. All right? All right. Good luck to you, Megan. Thanks for your question. Oops, let me try that again. Hello, Lori. Let's see. Hi, Dr. Ross. My daughter has Bartonella and is treating with azithromycin, rifampin, and liposomal oregano, I think is what you mean by the luregano. She's just had blood tested and her white blood cell count is down to 3.2. It was over 8 2 years ago. Do you see this in patients with Bartonella? So, I'll just make some comment. I can't speak specifically to your daughter's situation because I would need to know some more details, like when was the last time you had a blood count tested on her, okay? But, so a couple of comments. Number one, Bartonella and Lyme in some people lead to lower white blood cell levels, probably due to some degree of immune suppression. That can happen, okay? The other thing is the antibiotics sometimes can suppress the bone marrow, so that you're not making as many of the white blood cells. And so my comment was, I would to know if it's coming from the antibiotics, I would want to know what her white blood cell levels were before you started these antibiotics, okay? Because that would give us a comparison. So it could be either one of those. Now, having said that, a white blood cell count of 3.2 is still effective, all right? And in my practice with my patients, I would not necessarily change the antibiotics if I started seeing a level down that low, but I might keep an eye on it to make sure that it doesn't progressively keep dropping. If it did progressively keep dropping and start getting more into the 1 to 2 range, I might consider an antibiotic change on my patients in similar situations. Now, I don't want to, every doctor has got a different way of handling this. So you ought to talk with your own doctor to get the best advice for you and your situation though. Okay. All right. Thanks for the question, Lori. Hello, Kate. Hi, Dr. Ross. Last year, I took artemisinin for the first time, and ever since, I have been chronically inflamed. Headaches, fatigue, which could be from low ferritin, though, and probably clogged ears from the excess cytokines. I recently was tested for strongyloides IgG antibodies through my allergist, and it came back positive. Do you think these symptoms are from the parasitic infection? I've taken 2 doses of ivermectin so far. It's been about 2 weeks. We are thinking also of doing albendazole next month. I'm also starting LDN next week. Any insights? So when you have a condition that leaves you with a lot of chronic inflammation, clogged ears, excessive cytokines, I tend to think of what's causing the cytokines, what's got a person sick. So excess cytokines. So let's talk about cytokines first. So cytokines are inflammation chemicals that are made by white blood cells, and they're good and bad. When white blood cells see an infection, or they see a mold toxin in you, or they see a parasite, or they see the spike protein on COVID-19 in your vaccine, okay, your immune system is going to make cytokines, and it's making cytokines to turn the immune system on. In Lyme and in And in parasite infections and sometimes in too many yeast infections, the immune system doesn't do a good job, and eventually it manufactures too many cytokines. And symptoms of too many cytokines are fatigue, brain fog, hurting, headaches, all those things, okay? All right. The other thing, though, that can sometimes happen, so anyhow, I would wonder what infection has got you all inflamed. Could strongyloides be one of those? Yeah, it could add to that. The other thing that can sometimes happen is if your body is having an allergic reaction against yeast in your intestines, for instance, or maybe even against the strongyloides, you sometimes will make excessive amounts of histamine, and histamines can give you clogging of the ears, and histamines can give you the headaches, and histamines can give you the fatigue as well, too. So it could be the strongyloides is part of what's happening with you. It may be you've got more going on in terms of other infections like Lyme co-infections or too many yeast in the intestines that are adding to that, too. And I can't tell from here. I don't get to ask you all those questions to help sort that out, okay? All right. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. 2 questions. I tried to start Bioxin for Bartonella and couldn't tolerate it due to epigastric pain I have. My Lyme literate naturopathic doctor is switching to azithromycin. We'll eventually add in rifampin. I've heard Bioxin is more powerful at killing Bart than Zithromax. Is this true? My prescription is 250 milligrams. Is it better to take 1 2 times a day or 2 1 time a day? Also, when should I add rifampin in? After 2 weeks, a month? All right, so let's just talk about that, okay? So the only studies that we have that I can point to that compare strengths of different antibiotics to treat Bartonella are Petri dish experiments that come to us out of Johns Hopkins University. And these were studied over a year ago, the study was published. In that study, the authors compared different classes of antibiotics against each other, and they chose one representative member. Okay, so for instance, in the study, they used azithromycin, but that was meant as a representative for azithromycin and clarithromycin. They're in the same family. They chose doxycycline, and that represents the tetracyclines, which includes tetracycline, doxycycline, minocycline, okay? And they chose rifampin, which is a representative of the rifamycins, which includes rifampin, rifabutin, okay? And in that study, the 2 strongest antibiotic families were was azithromycin, representing the macrolides, and rifampin, representing the rifamycins. Okay, pretty good on Petri dish, okay? Now, Dr. Mozignani, who happens to be a doctor that treats a lot of Bartonella, he focuses his practice on Bartonella, has been, in his experience, is thinking that Bioxin, clarithromycin is stronger than azithromycin. And in his experience, he thinks that rifabutin is working better than rifampin, okay? All right, that's his opinion, all right? And it's based on his practice. It's not based on any published studies at all, all right? In my experience, I see that azithromycin and clarithromycin are pretty interchangeable, and they both have as good of a chance of working clinically. And I see that rifampin and rifabutin have as good a chance of working clinically. Okay, so Dr. Mozignani and I have different experiences. He has a different practice than I have. I have a practice that's based out of Seattle, Washington. His is based out of East, okay? Maybe it has something to do with the patients we treat. Or maybe he's right, or maybe my observations are right. It's hard to say because we have no studies to guide us on this, okay? In terms of doing this, if you can't tolerate the Bioxin, I would do the azithromycin. The azithromycin should be dosed as 500 milligrams a day. You can either do that as 250 milligrams twice a day, or you can do it all at once. To me, it doesn't make any sense to do it twice a day because azithromycin is an extremely long-acting antibiotic. And if you take it twice a day, that doesn't really alter the blood levels. That pill you take once a day or 2 pills you take once a day maintains a pretty solid level of drug in your body And so you don't get any advantage, I think, from doing twice a day, to be honest with you, okay? And in my practice, I tend to start the azithromycin and rifampin on the same day, okay? But I'm not going to, I would do that in somebody that I have a sense is not going to get clobbered by antibiotics. But if you're a person that tends to get a lot of Herxheimer reactions, what I would do with somebody that gets a lot of Herxheimer reactions, I'd start azithromycin first for a week. And if they're tolerating that well, not blasted by Herxheimer reactions, then I would add in the rifampin, all right? Why do I wait a week? Well, azithromycin, because it's so long-acting, takes about a week for it to maximize levels within your cells. So I want to wait a whole week to see what is the end killing result of the amount of the drug that builds up in your cells, which is where we want it to work, okay? All right. All right, part 2 to your question. Let's see. I know you tell everyone to get the COVID vaccine. My immune system doesn't like to be stimulated. Even when I get a cold, I can be very sick for months, and all of my tick-borne infections flare up. I'm so scared to get the vaccine for this reason, and I'm afraid it might cause irreversible damage to my body. Any thoughts on this? Any patients have irreversible side effects from a vaccine that you have seen? My brother got the flu shot in 10/20, and by that night developed hip pain and now has horrible pain, being diagnosed as rheumatoid arthritis. He's been unprecedented since 2 weeks after getting the flu shot. So I can't comment to the flu vaccine, okay? And what I can tell you is I've had, I recommend the COVID vaccine for all my patients. Out of everyone that I've recommended, I've had one person that got into severe prolonged symptoms that came on afterwards. Everyone else is tolerating it well. They do have temporary flares in their cytokines that most seem to subside within days to even a few weeks, okay? That experience that I just described reflects what happens in people that don't have Lyme as well, too, and reflects what the California Lyme Disease Association is saying, okay? In your situation, I can understand the caution. And I think ultimately it's going to be a personal decision for you to make. And also that's something you should be talking with your doctor about, who knows your health better than I do and can help you make a determination on that as well, too. I think you have to weigh out the risk of getting COVID and getting horrible inflammation that doesn't go away from getting COVID versus potential side effects that can happen on the vaccine. As you may know, I've been generally advising people when they get the COVID vaccine not to take their anti-cytokine medicines in the days leading up to getting it, because you don't want to block, potentially you don't want to block the cytokine effects because you need the cytokines to turn your immune system on to become immune. In somebody in your situation, I have been recommending that people do stay on their anti-cytokine medications so that it will make the vaccine more tolerable for them, okay? But I can't give you direct advice other than just to discuss these points with you. This is something you should be talking with your L&D about so that you get the best advice possible for your situation, okay? All right. Good luck to you, Gail. Hello, Nina. Let's see. Hi, Marty from Niagara-on-the-Lake. Hello, Niagara-on-the-Lake. I want to thank you. Your advice to resume Mariva helped normalize my blood pressure and heart rate with only 2 days. Amazing as the blood pressure has been high for 6 weeks post-Pfizer vaccine. I'm still left with serious brain fog, fatigue, and vestibular issues, but hoping the liposomal glutathione to kick in. If you have any other thoughts, please share your wisdom. I hope you realize just how helpful you are, as I always feel my health concerns are heard with compassion, and your advice is brilliant. Cheers. Thanks, Nina. So everyone, Niagara-on-the-Lake is in Ontario, by the way, just so if you're wondering where that is. So Nina, I know you're still having some increased brain fog post-vaccine. I have seen that happen sometimes in a smaller set of people. Not everyone, okay, but a smaller subset of people. I suspect that liposomal glutathione will take care of that with you, okay? But give it a chance. Yeah, and I think that's right, you're in Canada, you're only able to get one dose right now. So Canada, everyone, has got a different priority in how they're giving out their vaccines than what we have done here in the States. In the States, we've prioritized having people get their 2 vaccines within the time frame that they're supposed to. In Canada, they've taken a viewpoint because of the limited vaccine supply that it's more important to get at least 1 shot in everyone to get some level of immunity into the population, and then eventually they'll come back and do the 2nd shot, okay? So Nina, I don't know when they're going to free you up to get your 2nd vaccine, whether there's going to be enough supply, when you're going to have enough supply to do that. But what I have been doing with my patients in this kind of a situation, when they flared badly or more badly after the first vaccine, which isn't everyone, it's a small proportion, okay? But these are the situations you're going to hear about, of course, I hear about. I would probably for your 2nd vaccine actually go into it staying on your curcumin and staying on your glutathione before you get that done, okay? All right. Good luck to you. Hello, Tammy. Hi, Dr. Ross. You mentioned that when using herbals such as Capri Plus as a standalone treatment for Candida, that it may take 2 to 3 months to work. How do you know when it has worked and can stop taking it? Also, if continuing to stay on a combination of both herbal antibiotics and multiple prescription antibiotics after finishing Candida treatment, what do you recommend to do for maintenance to prevent it from returning? Does Candida become resistant to herbal treatments? So, it's a good question. So generally, when I've got somebody that has had Candida issues, or definitely somebody that's on prescription antibiotics, during treatment, I try to do things to prevent yeast, okay? And at a minimum, I want people on probiotics. And in addition, I usually like to have them on 1 yeast killer, which could either be prescription nystatin. It's a 500,000 international unit pill, 2 pills 2 times a day. That prescription is gentle on the system. It stays in the intestines, actually. It doesn't have any systemic absorption, so there's no toxicity from it, okay? So it's safe to stay on it month on month on month, okay? And that's what I usually have people do. The other option is to do your probiotics and be on an herbal yeast killer. And that would be, I like this Capri Plus, which is caprylic acid, rosemary oil, and garlic. Another product I like called Phytostan finally is back in production again. That's a product by Integrative Therapeutics. That's made up of caprylic acid, powder co, undulacinic acid, believe rosemary and thyme oil are both in that one. Okay, that's a good combination too. But I would do, if you're going to use your herbs as part of a maintenance program to keep yeast from coming back, either one of those, the Capri Plus or the Phytostan, which is Phytostan, 2 pills twice a day is what I would stay on, even after you think systemic yeast are gone, to prevent the return of yeast. Okay. Can you be on them long term? Yeah. I tend not to see resistance developing on those. That's not to say it won't, but I tend not to see resistance developing on those. And as herbal antimicrobials, they seem to be very safe. I haven't had any issues generally with people tolerating them. Okay. All right. In terms of how do you determine if you're done treating your yeast, a lot of that's just based on symptoms. So in my practice, that's what I'll do is I'll usually look to see, have symptoms of yeast that were there initially resolved. All right. So the common symptoms would be sugar cravings or excessive sugar cravings. We all like sugar to some degree, but excessive sugar cravings. Okay. Intestinal gasiness and bloating. Sometimes people will get a lot of increased acne when they have too many yeast in the intestines. It's because the yeast release toxins that interact with the skin that can lead to more pimples and acne. All right. Sometimes people with women with too many yeast in the intestines also get too many yeast in their vaginas, so they'll have vaginal itching, vaginal discharge. Sometimes people with yeast will also have a lot of feeling of food getting caught in their food pipe, okay, because there actually may be yeast there, and it actually is catching the food. All right. So you want to follow those symptoms and see do they get better. And generally, by 2 to 3 months with an herbal therapy, they will. If not, then you may want to consider continuing to treat or changing what you're using to treat. Okay. Now remember, I said the Capri Plus and herbal options will work about 80% of the time. Now, if one doesn't work, that doesn't mean another option won't work in terms of herbal options too, okay? Let's see here. There was another part to your question here. Oh, so the other thing too, if you're really at a quandary, wondering, are you done treating yeast? The only somewhat reliable testing I have found, and I hope you heard the word I said, somewhat reliable testing, is to measure an organic acid in your urine, which is called arabinose. And the company that measures that is Great Plains Lab, does a test called a microbial organic acid test, which looks at organic acids that are made by various germs. And one of the ones that can be fairly reliable for having excessive amounts of yeast in you is this arabinose test. So if I'm at a loss with a person because I can't figure out why they're so gassy and bloated, even if we've treated them a long time, sometimes I'll check to make sure if the arabinose is gone. If you remain gassy and bloated and your arabinose is normal, then you might want to start thinking about, do you have another condition leading to gassiness and bloating in the intestines? And those two other conditions could be intestinal parasites. Sometimes they'll cause gassiness and bloating. And the other one is a condition called SIBO, which is small intestine bacteria overgrowth. And small intestine bacteria overgrowth is caused by too many bacteria living in your small intestines that migrated there from your large intestines. In other words, they're not supposed to be there, okay? And if they do get there, they ferment your food and make a lot of gas out of it. So the way to see if you have SIBO is to do a breath test. And it's called a SIBO breath test. It will find SIBO if it's in you 70% of the time. That's about how accurate that test is. And one of the companies that does it is a company called Genova Diagnostics. It is a test that involves you drinking a type of sugar water and then breathing into tubes over a 2 to 3 hour period of time to see over that period of time what your methane and hydrogen levels are. And if you have a marked elevation of hydrogen and methane during that time, then we call that SIBO. Okay. All right. So those are just some thoughts for you. All right. Good luck to you, Tammy. Hello, Juliana. Hold on here just a minute. Hi, Dr. Ross. Let's see, I've been battling Lyme and Bartonella since July of 2020. I have made a lot of progress with herbs and immune boosting supplements and some rounds of antibiotics. However, my eyes have been a major challenge for me. Blurry vision, visual snow, brain fog, floaters, words on text moving around when reading. I've seen an ophthalmologist who believes that it is mostly coming from the brain more so than the eyes. Is this something you see often? And can this resolve with treatment? I would greatly appreciate your thoughts on this. So these kind of visual disturbances you're having, I agree, they probably are a mixture of the eye as well as the brain communicating with the eye. They can be seen in Bartonella, they can be seen in Lyme. So when they're there, I just keep treating for those infections with definitely being on herbal germ killers or prescription germ killers to get at them, okay? The other thing that sometimes can be helpful is to work with an optometrist, not an ophthalmologist, but an optometrist who does something called visual training. So there's exercises, eye exercises you can do sometimes that will help retrain the brain to integrate with the vision in your eye in a better way. And sometimes it's appropriate to do visual therapy as part of your treatment to get the eye and the brain to start connecting better and to start working correctly, okay? Finally, when you have these kind of neurologic dysfunctions, whether it's the loss of a use of an arm or visual disturbance like you have or decreased hearing, one of the things that I like to do is to try to work on fixing the mitochondria the energy factories that are found within all of our cells. But in particular, when you have neurologic injury, probably are injured along with that neurologic injury too. And if those energy factories called your mitochondria are injured, it'll be very difficult for your nerves to heal. All right. So every one of our cells has these energy factories called mitochondria. They're found in our immune cells. They're found in our skin cells. They're found throughout the body. When you have chronic infection going on, the immune system's reaction to that chronic infection is to make cytokines. We talked about that earlier tonight. But also some of the immune cells make oxidizing agents like hydrogen peroxide, okay? And so, for instance, hydrogen peroxide, some germs will, white blood cells can engulf a germ and then release hydrogen peroxide on the inside of the white blood cell onto that germ. Some of that hydrogen peroxide leaks out, and that creates oxidation injury. So having chronic infection can create an increased amount of oxidizing agents in the body. And those oxidizing agents damage fat membranes. So all of our cells, every one of our cell membranes is made up of a double layer of phospholipid fats. In addition, the mitochondria membrane is made up of a double layer of phospholipid fats. If the coverings of those phospholipids get injured by the oxidizing agents, that is going to lead to dysfunction on how the mitochondria works. You need a healthy membrane covering on your mitochondria to carry sugar and fat to the inside of the mitochondria where they can be burned through a bunch of chemical reactions to create cell fuel, okay? So any steps that we take to repair the mitochondria covering is going to repair your nerve cell membranes as well too, all right? So in a situation like this, what I often will do with my patients is I like to work to repair the mitochondria membranes, mitochondria function, and the nerve cell membranes. And there's two essential things I like to do, and sometimes I'll do a couple other things. So number one, I like to get them on an agent that will do phospholipid repair. And the company that has done probably the best job of making products to do that is a company called Research Nutritionals. They have 3 different products that can do phospholipid repair, and there's primarily 2 that I'm working with these days. One of them is a product called NT-Factor Energy, which has these phospholipids, and it has a bunch of micronutrients to help your mitochondria work better. One of those micronutrients is not coenzyme Q10. So this is a coenzyme Q10 free phospholipid complex, okay? Then the other 2 products that Research Nutritionals has, one is called ATP 360 and the other one is called ATP Fuel. Both of those have coenzyme Q10 in them in addition to phospholipids. The ATP 360 is meant to replace the ATP Fuel. It's a newer generation of phospholipid mix, and it's got some very promising research going on showing better mitochondrial function as well as better neurologic function, even better than the ATP Fuel. Okay? Now, the reason I raised the issue of coenzyme Q10 is in general, if you are taking Malarone, atovaquone, or Mepron to treat Babesia, you do not want to be on coenzyme Q10 because it may interfere with how the Malarone is doing or the atovaquone, okay? It does not interfere with everything we use, but it will interfere with that, all right? So if you're not on CoQ10 or not on a Babesia treatment with Malarone or atovaquone, then what I would recommend for your phospholipid repair is ATP 360, 3 pills 1 time a day. If you are taking atovaquone, then you don't want to have something that has coenzyme Q10 in it, in which case you would use NT-Factor, and that's 2 pills 3 times a day. Okay, all right. All right. In addition, those are fixing the outside. You need to do some fix to the inside, all right? And so every one of our cells, the master reparative, restorative antioxidant that is made in every one of our cells is glutathione. And if you have cell damage or mitochondria damage, they will have exhausted their ability to make enough glutathione. So we need to help them. So you can supplement the glutathione, all right? And now when you're doing glutathione supplementation, you got to be careful about the form of glutathione you use. You want to make sure it's a liposomal glutathione, because liposomal means that there's a glutathione microscopically wrapped in fat. And microscopically wrapped in fat glutathione is better absorbed than glutathione that's not microscopically wrapped, okay? So the product I like for that, because they also have good research showing good benefit in terms of getting it in the cells, is the Research Nutritionals liposomal product, which is called Tri-Fortify. And there's a Tri-Fortify orange and there's a Tri-Fortify watermelon. Either one's fine. You want to do 5 milliliters one time a day. Okay. All right. Also, if you have a neurologic problem like you're having and an energy problem like you're having, and you're trying to repair the mitochondria and the nerves, if you are a vegetarian, if you don't get any red meat in your diet, then you also want to supplement with something called carnitine. And I like to use the form called acetyl-L carnitine. And I use a product by Thorne called Carnitil. It's a 500 milligram pill. That Carnitil is a transport vehicle, or it's used as a transport vehicle in the covering of the mitochondria to carry fat to the inside of the mitochondria to be burned into cell fuel. Okay. So if you are not having red meat, because that's where you get it from, then you want to supplement it. And that would be at least 500 milligrams one time a day. Okay. All right. So that's kind of my repair formula for you. So I would talk to your eye doctors about possibly getting visual therapy going. And usually it's optometrists that do that, or if they don't do it themselves, they should know who somebody is in your area that would do that for you. Okay. And number 2, do mitochondria nerve cell repair by being on ATP 360 and glutathione, possibly with the acetyl-L-carnitine too. Okay. Or if you are on Melurone or atovaquone, use NT factor instead. All right. All right. That's a lot of stuff I just said. Let me do a quick screen share here and I'll show you the article that you can look at on those. All right. So this is a treat line by Marty Ross MD. In terms of doing neurologic repair, take a look at my brain and nerves section here. All right, and take a look at which one do I want to have you look at? You could take a look at this article called Brain Fog and Lyme Disease, You Can Fix It. It actually describes the same steps you would take to fix your vision. Okay, so take a look at that. All right. All right. And then in terms of some of the supplements I was talking with you tonight. So this is my supplement store. Many of you know I carry supplements. This is where my patients get their supplements. If you're looking for a source to get them, consider getting them here. We ship to you free as long as your order is over $50, and I cover the sales taxes, so you don't have to pay sales taxes here, okay? I cannot lower the prices any more than that because the manufacturers tell me that if I lower the prices below what they want me to sell them, then I won't be able to sell them anymore. So the way that I try to reduce your cost is to cover your shipping and to handle your taxes for you, okay? All right, so in terms of the Tri-Fortify, so I'll just write the word tri. So this is the Tri-Fortify orange, and this is the Tri-Fortify watermelon product by Research Nutritionals, okay? And then in terms of those 3 phospholipid repairs, the 3 products are this NT factor energy, this ATP fuel, or the ATP 360. Again, the ATP 360 is a replacement for the ATP fuel, okay? And then one last thing to show you. All right, so again, I know it can be confusing with all these products that Research Nutritionals has. This is an article that I wrote called ATP Fuel, ATP 360, and NT Factor Energy. Basically, what's the difference between them? It's a comparison article, okay? So I talk about it in this article too. All right. So Julianne, I hope that gives you some useful information to take a look at. Okay. All right. So let me move on here. Hello, LM. Hold on just a minute, everyone. I'm getting texted here and something I need to respond to, I think. Nope, I don't need to respond. All right. Anyhow, let's see. Would you kindly comment on the side effects of Disulfiram? So yeah, I'd be glad to talk about that. So Disulfiram, everyone, I think everyone's very familiar with Disulfiram these days, but it is a drug that we have historically used to treat alcoholism because it prevents the breakdown of a product called acetaldehyde, which is what alcohol is turned into in the body. And if acetaldehyde builds up, you get really sick on it, okay? And so we use it to make alcoholics sick so that they won't drink. That's what it's supposed to do, all right? But it was discovered in lab experiments at Stanford University a number of years ago, about 4 years ago now, to treat the non-growing form of Lyme, which is called persister Lyme. And that was all they saw. They didn't see that it treats growing Lyme, but at least their experiments said it treated persister Lyme. And so people started using it to try to see if they could move Lyme treatment along, and it has. I mean, about 40% of people seem to be able to get into remission using this. This is based on my experience, but also based on data that was published by Dr. Liegner, who's one of the first doctors that started using it in his practice. All right. So although I know a lot of people were rushing that this was going to be the thing that was going to cure them, it helps about 40% of people probably get to that situation. And so often there's a lot of people we still need to treat. Okay. In terms of side effects, number one, you have to watch out for foods that might have alcohol in them or things that can be turned into alcohol, because that could trigger that disulfiram reaction, which would give you headaches and would give you severe nausea and might give you severe body pain. Okay. So foods to avoid would be alcohol. You want to avoid fermented foods like kombucha, like sauerkraut. Okay, so fermented foods you want to avoid. You want to avoid vinegars. You want to avoid foods that vinegar is put in. So like mustard has vinegar in it. So you need to get condiments. You want to read to make sure they don't put vinegar in it. Okay. And in some people, you have to remove a group of chemicals called polyphenols because they might be turned into alcohol. And those polyphenols are found in teas, black teas and green teas, as well as coffee. Now, having said that, most of my patients tolerate their tea and their coffee well. I don't necessarily have them stop it right away, but some people cannot do that, okay? All right, so you can have a disulfiram reaction if you happen to have food with alcohol or that's converted into alcohol, and that would be headaches, severe abdominal pain, all right? The other common side effects that we tend to see on disulfiram are, number one, about 50 to 60% of people get fatigue on the medicine. It can be quite a fatiguing medicine, okay? Number two, about 30% of people, I'm trying to remember my stats on this, 30% of people, according to Liegner's research and also publication, and also based on my experience, about 30% of people can develop mental health problems, some of that very severe. Some of them can have psychosis and potentially hurt themselves, okay? Some people get severe depression. Some people get suicidal on it. Some people have anxiety, a whole range of experiences. So you have to keep an eye on that. This is one of those situations, if I've got somebody with severe mental health issues, I in my own practice, have not been using disulfiram because I don't want to trigger a severe mental health problem, okay? And then finally, about 15% of people will develop some form of neuropathy on this, which could be nerve pain or numbness or tingling. It used to be, or when I first started working with this medicine, many of us thought that when you stopped disulfiram, that within a week or two, that numbness or nerve pain would go away in most people, right? Or in everyone. I'm finding there's about 2% or more of people that get into permanent nerve damage from having been on the disulfiram. So when people start disulfiram in my practice, I'm advising them to be careful and to consider, do they want to take the risk of this medicine? Do they want to take a 1 to 2% chance risk that they might develop permanent neuropathy? Do they want to take risks that they could develop a bad psychiatric problem about 30% of the time? Okay. Do they want to take the risk of having to avoid certain foods in their life? So these are some serious questions, and you have to compare it against how many people really get help. So about 40% probably get into remission, and then there's a whole group of people that have a variety of other improvements. Now, I still use this medicine quite a bit, but I just want to say it's not the big Band-Aid that I think we all thought it was going to be. Okay? All right. Good luck to you, Alan. Let me do a screen share here. All right. So in terms of all this data that I was just telling you about, I've published an article about this that has all those stats in it. And that is this article here, Disulfiram for Lyme Update. And in here, I give you the chances of what the stats tell us. So 92.5% of people have some degree of improvement. About 36 to 40% get into prolonged remission. Okay. And then Liegner's data says about 50% of people have fatigue, 31% bad psychiatric problems, about 15% neuropathy. Oh, here's one other one. About 15% develop some liver inflammation. And then finally, about 50% of people cannot get up to the target dose, which is the dose that we find most effective because of too many side effects, okay? So it can be a hard medication to take sometimes, okay? There's one other side effect that people can get. So there's one other side effect people can get on disulfiram too, and is they can have some pretty severe Herxheimer reactions. We think that's for two reasons. Number one is from germ killing, but the other reason you may get bad Herxheimer reactions is disulfiram. Looking at the chemical structure of it, it has two sulfide bonds in it, or we call that disulfide bonds. And those sulfide groups can break down biofilms. So this appears to be a pretty strong biofilm buster, okay? Biofilms, everyone's, are a layer of slime that covers Lyme germs that the Lyme infection makes to block the immune system out and to block out antibiotics, basically, all right? So this is a great agent to break that down. Good luck. Thanks for your question, Alan. Hello, Jim. Let's see. Are any or all of the mold markers on the Great Plains Organic Acid Test useful for gauging how much mold a person has in their body? Also, I have pain off and on in the Achilles tendon, and I suspect Bartonella. Does Bart cause this? Do Lyme or other co-infections cause this? All right. So Achilles tendon pain could be tendonitis, which could be related to Lyme. I don't often think of tendonitis as being related to Bartonella. Okay, that's been my experience, okay? In terms of the markers, organic acid test looking at mold in the body, I want to talk about mold in a minute. So mold, actually, there's two problems. When somebody has mold toxicity, so mold can trigger mold toxicity. Actually, let me start over again. So the issue of mold toxicity is that when you're in a building that has mold in it, while you're in that building, there's two things that can happen. Number one, you might develop allergic reactions to the mold, okay? And that's the kind of situation when somebody walks into a mold building, they feel terrible when they're there, and then they get a lot better when they leave. That's probably because they're having allergic reactions to the mold. Right? The other problem that can happen in a mold environment is that you breathe in mold toxins in that mold environment, and those mold toxins get into your bloodstream. In 75% of us, our immune systems will break down those mold toxins in the bloodstream. But in 25% of us, our immune systems don't, and they become trapped in us. When those mold toxins get trapped in us, they trigger inflammation cytokines, just like Lyme does. So it can look like Lyme disease, okay? Right now, sometimes when you've been living in a building full of mold, you also develop a problem of becoming colonized with mold, where you breathe in mold spores from your environment and they start growing in small amounts that you can't see on an x-ray or you can't see with a test, but they're there. And if they grow in your nose passages or they grow in the intestines, they turn you into your own mycotoxin, mold toxin brew pub, basically. You make your own stuff. All right. So when you're trying to see if you have a problem from mold, we're really primarily talking about mold toxins. The best test to see if you have mold toxins is not the organic acid test, but is rather a urine mycotoxin test that measures whether you have these toxins in you, okay? All right. Now, most of us, since we don't really have a good test in terms of doing a nasal swab or doing a swab of your intestines to see if you're colonized with mold, what most of us will do is start to use mold binders to help remove those mold toxins. And if we've done binding of molds, trying to remove mold toxins, and they still remain in you after, say, 4 months, 6 months, then it's possible that what's happened is you actually are colonized and that you are producing your own mold toxins. So the way that most of us will make that diagnosis of mold colonization is if we are doing mold toxin binding and somebody's mold toxin levels are not dropping and they're not getting better, then we start thinking they're probably colonized and we start treating for colonization, all right? In terms of whether the organic acid test through Great Plains, because they have these organic acid test markers, some of these organic acids might be elevated if you have mold colonization. In theory, that sounds like it'd be a good way to figure out if you're colonized, but no one's done the studies to say that it actually is accurate. So I don't use them. I tend to go more on, I do it by what I call diagnosis of exclusion. That is, we try binding the toxins and somebody is no longer living in their mold environment and their mold toxins aren't dropping. Then I start thinking that they're probably colonized. And it's at that point I start using things to kill off the mold colonization. Okay? All right. Good luck to you, Jim. Hello, Lynn. Let's see. Hi, Dr. Ross. If I'm already taking liposomal cinnamon, clove, oregano oil for persisters, can I also take Capri Plus for yeast, or is that too much oregano oil? It will be hard on the intestinal lining. What dosage would you take of each? And would you take nothing to protect the intestinal lining? Yeah, I have had patients. So in people that are tolerating their liposomal cinnamon, clove, oregano oil, and I think they get yeast, then I will go ahead and try to add the Capri Plus, and often people tolerate it well. Okay. If I've got somebody, though, that is having a lot of stomach upset on the liposomal cinnamon, clove, oregano oil, then I may not necessarily want to go ahead and use the Capri Plus, which case I probably would do that Phytostan product I was telling you about earlier, 2 pills 2 times a day. Okay. Now, one of the things that can happen with these oils, these volatile oils, is they can give you gastritis. They can give you a lot of irritation to the stomach lining. And what I am finding to be very helpful to help deal with that and to prevent that from happening is to have a person take licorice. So herbal licorice, medicinal licorice, not the candy kind of licorice, but the medicinal kind, okay? And so what you do is you can chew licorice tablets. You can chew a couple of them before you take about maybe 5-10 minutes before you take your liposomal oregano or your liposomal cinnamon, clove, oregano. You chew the licorice tablets, and your spit and saliva will interact with chemicals found in the licorice to create a microscopic gelatinous coat that will cover the food pipe and even cover your stomach to make it so you're not as irritated. Okay, so I'll do that. If you're looking for a source of this licorice tablets, take a look at my supplement store. There's a product there called Rhizinate. That's Rhizinate by Integrated Therapeutics. That has it's got a couple other things in it too, but the main part of that is the licorice. I just have people chew 2 tablets before they take their capsules a couple times a day. Seems to be just fine, okay, for the majority of them. Okay. Good luck to you, Lynn. Looks like a repeat question from Juliana. Let me get, it's the same question. I've already answered it once, so let me just get rid of it here. Hello, Sam. Hello, Dr. Ross. What herbal option for babesia do you see the most success with in your practice? Have you ever successfully treated anyone in your practice with herbs only for babesia? So to answer the last part of your question, yes, I have. And often if I'm going to use an herb-only option, what I find most beneficial is to use cryptolepis along with artemisinin. I'll do both of them. And another one that I have had some more limited success with, but it can work, is to use a product called CSA, which is made by a company called Woodland Essence. And that CSA stands for cryptolepis, Sida acuta, and Alcornia. Okay. But I prefer to use just crypto by itself. And so if I'm going to do a crypto artemisinin regimen with my patients, what I'll wind up doing is the cryptolepis comes as a tincture. And I usually will have people do 5 milliliters, a teaspoon of it 3 times a day. The artemisinin is manufactured by one of 2 companies, a company called Baluki that has it. And there's also artemisinin by Allergy Research. I try to have people start at 100 milligrams or 200 milligrams, and they have them take it 3 times a day for 4 days. I'm sorry, for 3 days in a row, and then they're off for 11 days. Okay, so 3 days out of every 2 weeks. If you tolerate that first round, then you go up to 300 milligrams 3 times a day. And if you tolerate that round, you go up to 400. And eventually, if you can, you try to get up to 500 milligrams 3 times a day. All right. Now, the reason we use it that way, and then I don't have people take it continuously, and the reason I go to a really high dose on the days we use it, is that the liver can develop enzymes that will deactivate the artemisinin if you use it too many days in a row. So what I try to do is only use it long enough so that we don't trigger the enzymes in the liver that deactivate it. Okay. The Chinese had been using it to treat malaria, and they found that if you just used it at really high doses for 3 days, that it could work it could work better than taking it continuously. So it seems to be important to use it at high doses for the 3 days. The one last thing you should know about artemisinin when you use it at the high doses like that is up to about the 5th day of when you take it. So if you take it on day 1, 2, and 3, day 4 and day 5, you don't take it. But up to that 5th day, you may experience more air hunger on those days. You may get more fatigue, and you may get more night sweats on those days too. All right. And if all those reactions are too much, that's when you don't increase it at the next dose. You just stay at the same dose you were on before. Okay? All right. Good luck, Sam. Thanks for the question. Hello, Joyce. Let's see, hi, Dr. Ross. I noticed different brands of the same herb, say a Tobabach or cat's claw, makes you feel different. Are you able to share your knowledge on this? Thank you. I guess I would need to know which brand you're talking about. It all depends. So each of these brands makes their things a little bit differently. So for instance, Nutramedics has Banderol, which is its Otobabark, and Cemento, which is its cat's claw. There's another brand that I have stockpiled over the last, or about a year ago, and I'm actually about ready to run out of it, unfortunately. But it's a brand called Wildcraft Herbs, Wildcraft Herbs has stopped producing. I just happen to have a big truckload of the stuff. But they do a different way that they prepare their herbs. They have done a method where they put 3 parts of alcohol to 1 part of plant, a 3-to-1 distillation, versus I believe that the Nutramedics has been using a 6-to-1. They don't quite use as much plant and a lot more alcohol. They claim in their distillation method that they get more of the active ingredients out compared to a Wildcraft Herbs. But it is my opinion, I think the Wildcraft Herbs has been a stronger product than what the Nutramedics product has. Okay, that's just been my experience. So the problem with tinctures is none of the manufacturers of tinctures, they usually talk in terms of how much plant per liquid. Okay. There's no way of comparing directly any of these products because none of them put how many milligrams per teaspoon of active ingredients are in there. We don't, that's not quantitated with any of these, okay? So it is possible that different brands and how they come up with their distillation and they can create their concoction, their liquid. So basically when you put these plants in alcohol, it extracts out the active ingredients, okay? And so you may get different concentrations of these active ingredients based on how it's prepared by the manufacturer. All right. Joyce, thank you for that question. Let's see here. Hello, Kim. Let's see. Thanks for all the great info and resources you provide. My question is, I have always had really bad adrenal fatigue issues due to messed up cortisol and a high level of stress since childhood. Excuse me, everyone. My allergies seem to be acting up here today. Since starting Lyme treatment in January, it's gotten so much worse. I feel like I'm running a marathon just to get a simple task done. Is there anything I can do or try to help? I tried cortitrol, but it didn't help. And I take a lot of supplements, including iron, D, etc. And I do light exercise. Nothing seems to be helping. I'm just exhausted more than ever, even winded after 1 flight of stairs. FYI, I'm only on doxy antibiotics and a ton of supplements. Thanks, Kim. So, Kim, I can only provide some general observations because I don't know enough about your whole situation or the specifics of each herb that you're taking. Okay, so these are just for general comments. Ultimately, you may want to talk to your doctor about this. Okay, all right. So, one of the things that can lead to bad fatigue when you start killing germs is killing the germs, and that killing the germs triggering your immune system to make more cytokines. Sometimes we call that a Herxheimer reaction, all right? So as your immune system sees the dead germ parts, it's going to manufacture more cytokines, and those increased cytokines cause fatigue, all right? They also cause your hormonal systems not to work as well, like your thyroid and your adrenals. So number one, make sure you're doing things to control cytokines when you have fatigue. So I like to have people take at least 500 milligrams 3 times a day of a liposomal curcumin as an option, okay? The other thing I like to do in my practice to control those cytokines when I've got somebody that's reacting like you are is to get them on glutathione too, which can help. And I like using the Tri-Fortify glutathione, and that's 1 teaspoon a day. Now, you may already be on these, okay? But I just want to comment. You want to, if you get bad fatigue during treatment, make sure you get your cytokines under control. Number 2, support the adrenals. And so I usually like using ashwagandha to do that. If you're doing herbal supports, and maybe the cortitrol was one way of doing it, and you're still extremely fatigued, have your doctor check your cortisol levels. You could either do that with blood testing, or you could do that with adrenal saliva testing. And if they truly are low, and the herbs are not supporting raising them well enough, then you might want to actually do prescription hydrocortisone is something that sometimes can help with that, okay? The other thing is if you've got all these excess cytokines running around, they may be interfering with how your thyroid hormone, your thyroid gland functions, leading to fatigue too. And so as part of their evaluation of fatigue with you, somewhere along the way, and maybe even now, they should be looking at what's happening with thyroid function, all right? And then finally, while being on antibiotics, generally most people's bodies and their organ systems tolerate the antibiotics okay, but sometimes they don't. So if I've got somebody with severe increased fatigue and nothing is working, I'm going to want to come back and recheck my blood testing. I'm going to want to check and see how the kidney and liver are working, and I'm going to want to look at blood count studies as well too, okay? That's how I would approach a situation like this in my practice. Talk with your doctor about this though, okay? You can even share with them my thoughts on it too. All right, good luck to you, Kim. Hello, Anna. Hi, Dr. Ross. Based on your 2 weeks ago seminar, I'm still not clear when it is the best time to take binders like charcoal, cholestyramine, clay, etc. If one takes antibiotics and supplements with food, how many hours are required before and after the binder? All right, so I'll try to make this clear. There is a 2.5 hour block of time around your binders when you do not want to take any medicines or supplements, okay? 2.5 hours. And what that means and how you measure that is that the 2.5 hours begins 30 minutes before you take your binder and ends 2 hours after you take the binder. All right, so 2.5 hours, can't take any supplements or medicine in that time period, except half hour after it begins, you take your GI detox, then you wait 2 hours, and then you can take your other medicine supplements again. All right, that's pretty clear. All right. All right, now, what may have confused you is I said that you can eat any time though, and you can. When you take your binder and in a 2.5 hour block, you can eat any time. Now, just because you can eat any time when you're in that 2.5 hour window does not mean you take your medicines when you eat, okay? Because you can't take them in this 2.5 hour block of time. The best time to eat a small amount of food when you have you're in this 2.5 hour binder window is 30 minutes after you take your binder. And it can be just a little bit of food. And the reason that that's the ideal time is when so your liver will process the mold toxins, try to clean them out. Doesn't do a good job though, but it will take them, and the liver is supposed to be able to take your fat-soluble toxins and turn them into a water-soluble form, and then move them out into the intestines through the bile system, which includes the gallbladder. Now, half hour after you eat, or when you eat, it causes the gallbladder to contract, okay? And it takes about half an hour after you take the binder for it to get into the part of the small intestines where the gallbladder squeezes its stuff out. All right, so it's like a baseball and a mitt. You want to have them at the same part at the same time, all right? So to be very clear, 2.5 hours. No other medicines or supplements in that time period, except half hour into the 2.5 hours, take your GI detox. An ideal time to eat is about 30 minutes later, but it doesn't have to be your full meal. It can be just a little snack, okay? You can eat any time in here, but the ideal time would be there, okay? At the end of this 2.5 hour window is when you can start taking medicines and supplements again, all right? All right, let's see here. 2, besides mycotoxin, are the binders supposed to bind toxins caused by antibiotics as well? So I'm not sure what you mean by toxins caused by antibiotics, because I'm not aware of antibiotics causing toxins. Now, germs, when we kill them, sometimes release the inside parts, which some of those are toxins, but your liver, which should be able to clean those out and break those down, okay? Let's see. If you take food without antibiotics, can minerals and nutrients from food be absorbed by the binders? Generally, they are not. All right, there you go. I hope I clarified all your questions there. All right, good luck to you, Anna. Hello, Julia. Let's see. Hi, Dr. Ross. Thank you for everything you do for the Lyme community. You're welcome. I bought cinnamon, clove, and oregano oil from doctor-inspired formulations. Is it okay for me to take it constantly for months, or do I need to take a break every once in a while because of the oregano oil? Is oregano oil safe to take for long periods of time? Yeah, I'm having people take this even up to 6 months or longer in my practice. And that is the product I use in my practice, is the doctor-inspired formulations product. That's what I sell on my supplement store as well, too. So yeah, I'm having people use it for months. No problem at all. Okay. All right. Good luck to you, Julia. Hello, Joanne. Let's see. Do you have experience with treating Lyme disease that may be causing severe pain in status post total knee replacements? X-rays are normal. I've been on and off of oral antibiotics for almost 4 years. I don't. And I would question why you're still having inflammation in there, given that the inside of your knees are basically all artificial. I don't have a good explanation for you, unfortunately, Joanne. All right. Hello, Damien. Is there a way to tell if night sweats are from babesia or another issue like hormones, thyroid, candida, etc.? Okay. There's not a definitive test, but this is kind of what I go through in my practice to try to make a decision as to what's going on. So night sweats from babesia are very often going to be heavy sweats. They're going to be enough to get you sweating into your clothes and probably soak them to some degree. And they usually tend to be nightly. They're not going to be an every now and then sweat, okay? So they tend to be heavy and pretty profuse, basically, and pretty regular. In addition, they don't usually just occur as the only symptom of babesia. If they are a symptom of babesia, often you're going to have other babesia symptoms like air hunger, like racing and skipping of the heart, like headaches in the front of your head, like repeated deja vu experiences, okay? So it's not going to be something you're going to see just in isolation, all right? Now, another thing that can lead to sweating, and this is nighttime and even daytime sometimes, is excessive cytokines. So when you get the flu, how many of us get sweaty with the flu? What's triggering all those sweats in the flu is cytokines, okay? So excess cytokines from having chronic infection in you can trigger damp, clammy kind of sweating, stuff that's kind of there in the background most of the time. It's a little bit of a lighter sweat than the heavy sweats people tend to get with babesia, okay? That's kind of how I make a distinction on it. And then finally, in women, we have to be careful in women that get into the perimenopause period and menopause, where their ovaries stop making as much estrogen or stop making it altogether once they are fully in menopause. That can trigger night sweats. And that gets to be a little trickier to figure out where that's coming from sometimes, okay? All right. Thanks for that question, Damien. Good luck. Hello, Eileen. Let's see. Hi, Dr. Ross. Thanks for all your help. You're welcome. Is there anything you would suggest to reduce the inflammation that can be taken with Eliquis? Cannot have either curcumin or quercetin. Thank you. Boy. I don't know for sure. I would have to look into this. I would have to research it. Okay, but you could even research it too, or have your doctor research it. It's possible that, so with cytokines, there's two ways to control them. One is to get inside the white blood cells where they're made and block the factory production line, interfere with the production, okay? And what does that would be things like the curcumin and the quercetin, okay? And obviously you can't take them, okay? The other way to limit cytokine inflammation is to block the signals that tell your white blood cells to make cytokines, all right? And those are oxidation agents. So sometimes being on antioxidants will lower your cytokine production and therefore lead to less inflammation. I do believe, and so to do that, I usually would use glutathione, liposomal glutathione. I am not aware of any reason you cannot take that with Eliquis, but I don't know for sure. I would have to research it to see. You should ask your doctor if they can help you figure that out, okay? All right. Thanks for that question, Eileen. Hello, Kim. Let's see. The dog behind you is cute. What's his or her name? Well, that, everyone, that is Thor. He is, I actually have two. This is one of my Basenjis. Thor, you're a star. They want to know about you. Ooh, that's a big stretch. So that is Thor. He's one of my two Basenjis. And, Halo, you want to come here? Come here. Come here. Come on. Come on. Oh, I guess Halo may not join us here. Let me see if I can get her up here. Come on, Halo. Come on. Come on. You ain't come. Come on. Oh, well, she's not going to come. No, I know that just sounded like I heard her. That's she's a Basenji. Basenjis will make sounds when they don't want to do something, even though you're not hurting them. So I did not just hurt her, but that was a Basenji screech. Anyhow, I have two Basenjis that come to work with me. They've been with me for a long time now, actually. Halo is now 13 and a half, and Thor is 12 and a half years old. So I feel blessed by the time I have with them, and they're both starting to slow down, but they like coming here. And as the pandemic opens and I start seeing more patients in office, they get to visit with patients if they want them to. So some of my patients like to visit with them as well. But thank you for asking about them. So they're Basenjis is what they are. All right. Thanks for that question. Or thanks for that observation, actually, too. All right. Hello, Kendra. Let's see. What do you feel about the Lyme Stop treatment? So Lyme Stop is a program in Idaho, and the chiropractor there has trained some other physicians that are now located in other parts of the country as well, too. And they do a program that involves using magnets, which is energy to kill germs. And also they do some herbal treatments for the germs as well, too. There are some people that get benefit from doing that program. On the whole, I don't think it's a universally successful program. And that's just been my observation. But having said that, I mean, there are some things that work for people that maybe it doesn't work for everyone, but a small percentage of people it does, okay? It tends to be a program that attracts people that don't want to use antibiotics because they say they can do it without antibiotics. And, you know, for some people can treat Lyme without antibiotics. I mean, there's a number of people in my practice that I treat their Lyme without using prescription antibiotics. We get them well using herbal antibiotics only, all right? But there's a large part of people that you may need to do prescription antibiotics. And, hoping that magnets are going to work is not necessarily going to make it work, okay? So I think I just gave you my opinion on Lyme Stop. I don't think for the majority of people that magnet therapy is a way to get rid of this germ, okay? All right. Thanks for the question, Kendra. Hello, Kay. Let's see. My 13-year-old daughter has developed about 10 to 12 horizontal striae across her back. She is of average height and not had any sun growth spurt, very thin. She was exposed to a variety of toxic molds for a while, several months, up to possibly 1 year or so, as we had leaking in the house and we were just unaware of. Her pediatrician said it's probably just stretch marks, but I disagree. Are striae a main symptom of Bartonella? What are your thoughts? So yeah, striae can be a main symptom of Bartonella. And in those areas that you just described can be the kind of areas where you might see them develop. I would, to figure out that it doesn't mean that that's what's causing her striae, but they can be a sign of Bartonella. And so other symptoms that can indicate Bartonella are pain on the soles of the feet, fatigue, a lot of neurologic symptoms like numbness or nerve pain, psychiatric issues like ongoing anxiety, depression, OCD, a lot of tremors or shakes sometimes having air hunger or other things we might see with Bartonella. You might want to see if you can find a Lyme literate medical doctor out where you are to see if they could evaluate your daughter and see if they think it's Bartonella or not. To find a Lyme literate medical doctor, go to the group called ILADS, ILADS.org, and they do have a place where you can ask them where doctors that are trained by ILADS or are members of ILADS, which ones are in your area, basically. Okay? All right. Good luck, Kate. All right, everyone, that's it for me for tonight. I've got one screeching Basenji under the desk that I need to go say I'm sorry to and get her out for a good walk this evening. Mr. Thor is ready for his walk this evening as well, too, and I'm ready for my walk. It's been nice visiting with you again tonight. I had been off for a couple weeks, and it's good to be back again. I will be here again next week and the week after, tomorrow morning, somewhere, I hope, before 9:30 in the morning. To get an email out to you with the edited version of tonight's recording. And that will also have sign up for next week's webinar. I hope you join me then. And as I asked earlier, make sure you share this information with others that you think might get some help. I'm trying to reach as many people as possible. Okay? Join me in that mission. All right. Good night, everyone.